Though. We want to do some new things.
We'll talk about that
Good.
as well.
Thank you.
Now over to Mr. John Bruce.
All right, thank you so much, Tom. Cognitive behavioral therapy is used to treat patients dealing with anxiety and depression. Ginger Beatty is Director of Child and Adolescent Services at Palmetto Lowcountry Behavioral Health. She joins us today along with Shelby, the therapy dog, who's stretching out, getting a little comfortable in our studio today. Well, tell me all about, Ginger, tell me all about Lowcountry Palmetto Health a little bit, what you guys do.
Okay. At our hospital, we have acute settings, so then that way we can work with patients that are struggling, whether it's substance abuse, depression, if there's thought disorders, if there's bipolar or anything like that. So we have an acute setting, as well as we have a residential treatment facility which works with children that need long-term help. And then we also have outpatient programs. We have a partial hospitalization program for the adults as well as the adolescents and children, and we have an outpatient care program for substance abuse in the evening.
Well, how exactly does it work if your child, shows up and you guys can diagnose that problem, or already comes with their diagnosis? How do you actually help them along? How does this therapy work?
Well, one of the therapies that we use is cognitive behavior therapy, and with this therapy, it's an evidence-based treatment practice, which means it's supported by a lot of research. And what it does is it focuses on specific problems. It provides education, it's goal-oriented, it's time-limited, and overall the patients take an active role in their learning. And what they learn with this behavior is they're going to learn to identify and evaluate their thoughts, because what we want is for them to be thinking more realistically, so that way they can feel better emotionally, and then the outcome is then they function better.
Well, absolutely. It sounds like a great program. Tell me about Shelby a little bit and how she fits into the
Well,
therapy
Shelby
program.
fits into with the cognitive behavior therapy, and with the patients a lot of times they come in and they're depressed, they're anxious, if there's trauma going on, there's all that feeling. So what we can do is Shelby will sit with them, they can, pet her, she helps him calm down. One example is one time we had a child on the long-term unit, and we walked on the unit and she was just so distressed. She was crying, balled up, and Shelby got in the middle of us. And when she did, the little girl looked down, and of course the child's like this, so Shelby is just shaking. So she goes, "What do we need to do?" And I says, "Well, I tell you what, why don't you pet Shelby and talk to her calmly, and let's see if she calms down." So what happened in this process is the child is petting the dog, talking to the dog, Shelby calmed down, and then the little girl noticed she had calmed down.
And that
so
kind of helps her come out of her shell a little bit and deal with some of these things.
Right. That's those self-soothing activities that we want them to participate in so they can learn to calm themselves when these emotions arise.
Yeah, and Ginger, you guys mentioned that you treat mood disorders, anxiety disorders as well. What are some of the other conditions that people can help seek your help and get these under control?
If they are struggling with PTSD, post-traumatic stress, if they're struggling from any grief and loss, if they're struggling from substances, if there's any type of illness going on that is affecting them with their daily life, that they're not able to function at home, in the community, or at work, then they can come to us, and we offer free assessments. So there's no cost to come to us, and a master's level therapist, provider will assess them and then determine what is the best treatment, whether it's outpatient, partial, inpatient, or a residential
program. Well, that's
program.
what I wanted to ask you about, because we all deal with bouts of depression in our lives, over everyday things sometimes. When is it necessary to get some professional help?
When you feel like you're not able to function, when it's really hard for you to get out of the bed in the morning, when you see that there's problems in relationships. If it's a child, if your child is all of a sudden they were making good grades and then they're not making good grades, if they're withdrawing, if they're isolating. So it's looking at those thoughts and the feelings and the behaviors that's going on.
All right, well, how do we get in contact with you, just in case somebody might see this at home and wants those services?
They just need to call the main number, which is 747-5830.
Right there on the screen, the website, all there as well with all that information. And Shelby, thanks for being so good.
Well, Shelby, come here, Shelby.
You're such a good girl today.
She is. She's a wonderful dog, and it's amazing what she can do, especially children coming into the hospital for the first time. They get scared, they're frightened, and what Shelby does is just provide a little bit of comfort.
And a little bit of laugh as well. There you go, Shelby. Show your good side right there. Well, Ginger, thank you so much. We appreciate you being here.
Oh, thank you for having me.
A lot of great information. We'll be right back. Stay with us.
Thank you.
This segment was sponsored by Palmetto Low Country Behavioral Health.